Welcome to the press briefing. We have today Dr. Chuang Chuk Kwan from the Center for Health Protection and Dr. Linda Yu, Hospital Authority Chief Manager. First of all, Dr. Chuang will give you an update on the number of cases. Good afternoon. Yesterday, there are 109 confirmed cases. 7 are reported cases, 102 are local cases. For local cases, 42 of them are untraceable. And then for the other 46 cases, they are linked to other earlier cases. And there's one from Kwai Tong House, from the known, the person is a close contact of known units. And then Ming Wai House, there's also a family member of known cases in the units affected. And then there's one related to the Yatta case, 2 from Lohas Park, Phase 9, Block 1. Again, it's a linked case. And then there are 2 cases from the Belize Music School. And then one from the dance club cluster. And then from Cheung Kwan O Lam Tin, that's one case, a tunnel case. And then there are 47 cases linked to other cases, such as family clusters or workplace clusters and so on. And then for some of the buildings, we are going to distribute specimen bottles. One of the buildings is the Fuyet House, Fusan Estate. There are 3 units affected. And in these 3 units, there are family members affected, 2, 4, and 2 respectively in the 3 units. And they are family members. And these are cases with unknown sources of infection, but they are on different units with different orientations, so we'll be distributing specimen bottles. The next building is Shek Lei 2 Estate, Shek Ming House, 3 units affected again. For some of the units, they're related to the dance club cluster. And for these 3 units, again, they're on different floors or blocks with different orientation. And then there are 4 patients in these 3 units. Ping Tin Estate, Ping Shing House. Again, 3 units on different blocks with different orientation. So 3 units involving 4 persons. In 1 unit, there are 2 patients. And then there's Sky Park in Mongkok, 3 units, 5 persons involved. And then Kwan Yik building, Phase 2, Block D, 3 units, 8 persons involved. In 1 unit, there are 6 family members who are confirmed patients. And then in the other 2 units, there's 1 case per unit. And then today we are going to issue a mandatory testing notice. And it covers one of the units we mentioned yesterday. Number 8 Fong Ha Road, Taiwan, King Choi Court. Yesterday, we said we distributed specimen bottles at King Choi Court. We've done so. But still, there are now 1 or 2 additional cases confirmed today. Actually, there's 1 more unit involved now. So altogether, there are 6 units that have been affected. For the new unit, there's 1 person involved. And then in the other 5 units, there's 1 more case. So we believe the number of units is on the high side. That's why there will be need for mandatory testing. And then for this building, therefore, there will be mandatory testing. And then previously, Richlands Garden, Block 6, there's need for the second test. So notice will be issued today. We hope that the residents will take the second test between the 20th and the 24th of December. Hopefully then we're able to identify those still in incubation. So that's all from me. Thank you. Good afternoon. As at 9 a.m. In the past 24 hours, in the hospital authority system, we recorded 124 cases reported. In the past 24 hours, there are another 108 confirmed patients discharged. So far, 6,730 confirmed and 1 probable patients have been discharged. And then there are 1,073 confirmed patients in the 22 public hospitals and the Asia World Expo treatment facilities. 61 are in critical condition, 63 are in serious condition, 948 are in stable condition. Negative pressure beds 1,241, occupancy 70.4%. Negative pressure wards 681, occupancy 76.7%. As for the Rachinji Hospital, on the 15th of December, a female nurse conducted a home visit for a 97-year-old female patient. This patient became a preliminary positive case at the Eastern Hospital. During the home visit, the patient was unwell, and the patient was receiving oxygen treatment without wearing a mask during the visit. The nurse followed the prevention of infection measures and wore personal protective equipment. The nurse carried out a care assessment for the patient. The nurse stayed at the patient's home for about 30 minutes. After the patient became a confirmed case, the nurse was classified as a close contact and she has to go into quarantine. So that's all from me. Thank you. The floor is now open to questions. Please, before you ask questions, identify your organization. It's over here, please. I'm from Commercial Radio. Yesterday, there's a patient who ran away. For this patient who ran away, or as a result of this case, would there be people who need to be tested as a result? And where has this patient been? Have you been able to find out? And for this patient, what's the infection risk for others involved? And how can you make sure that similar incidents won't happen again? That's the first question. Second question, for King Choi Court, Taiwan, there's 1 more unit and 1 more infection case. So these units, how is this unit related to the other units in any way? For example, are they on the same floor, or are they the same unit vertically, or did people there have any contact previously? And then you mentioned there are 42 untraceable cases. So for these 42 cases with untraceable sources of infection, what is the situation there? And is 42 a record high figure? For the Queen Elizabeth patient who left, now we know that as he left the ward, he was wearing a mask. Now, if members of the public or healthcare personnel were wearing a mask or suitable PPE, then the risk of infection is not high. But of course, we don't know where this patient has been since he left the hospital. And then, of course, we want confirmed patients to cooperate with us because they are not well, so they need to receive suitable treatment in the hospital. They shouldn't leave the hospital on their own. They have to protect their own health and the health of the public. Thank you. King Choi Court, that's 1 new case in a new unit. So now altogether there are 6 units involved. And for this new unit, it's the same unit number as another unit. Otherwise, there's no other link. Sorry, speakers did not come through. So vertically, it's the same unit number, and there are altogether 6 units with infection, and 2 units have the same unit number. And we've seen similar cases before.
Concerning the 42 patients, I covered different strata of society. Some are housewives, retirees, some are workers, some may work in restaurants, and some are from schools and some students. So basically all strata of society. So how is the 42 a peak? No, I think in terms of figures, it's high, but it's not the highest. Next. Yes. Regarding the patient that fled from QE hospital, could you tell us more? Why or how he was able to get away? Because I understand that should be security guards and there should be a lot of doors. How was the patient able to go through so many doors and security and leave the hospital? And regarding the delay in sending people to quarantine centers, the Department of Health pledge a certain number of people to be transferred to the quarantine center. Is this a pledge? And Ms. Sophia Chen said today that she might need to enlist the help of other departments in order to expedite the transfer. Is there already a mechanism, or is this something that needs to be discussed? Or is it that there is a mechanism in place but the Department of Health has not used it? Regarding the QE case, looking at the ward that he was in, it was a negative pressure ward, an isolation ward. There were 2 automatic doors in order to maintain the negative pressure in the room, and such devices were working or functioning properly. Sometimes when patients require, they may need to go outside to ask for help from the medical officers. From time to time, we'll also monitor the patient's situation, and there are also central surveillance devices with no recording. But sometimes, if a patient acted very quickly, then if he rushed out, we may not be able to catch him. Are there any locks? If a patient needs to go out of the ward, there is no lock. He needs to kick some buttons and he will be able to go out. Yes, I understand that last night, over 480 close contacts were transferred to quarantine centers. This is a special exercise, and I think the backlog cases were more or less cleared. Normally, we try to deliver a close contact, and if there is already a mandatory testing order, then they will send him to a quarantine center within 24 hours. And because of some evacuation exercises, the manpower was short, and as a result, there was some delay. And now we'll try to deliver the close contacts, contact the close contacts and then have them delivered to quarantine centers within 24 hours. In some cases, the patients might require special arrangements, for example, taking care of certain people, or they might require special meals, or they may need to take care of their pets, etc. And that might delay the process a little bit. But normally, we'll try to arrange for delivery of these close contacts to quarantine centers within 24 hours. Sorry, the speaker's not coming through. Now, today we have some confirmed cases. Then definitely there will be other close contacts that need to be delivered to quarantine centers. But previously, there were some cases where there was a long delay, and they have already been cleared. Hello. Yes, I'm from cable TV. Just now, you mentioned there was a Fushan estate case. Yes. In Fushan Chun Fuyet House, there were 3 units. Altogether, how many patients were confirmed cases? Just now, I might have missed that. And concerning the close contacts issue, for the CHP, what is the mechanism for delivering close contacts to a quarantine center? How do you define whether certain people are of more serious situations than others? Or is it that for all close contacts, they will try to be delivered to quarantine centers within 24 hours? And apart from the evacuation exercises that might have led to manpower shortage, will there be other reasons for delay in the delivery of patients? Concerning Fuyet House, there should be 3 units, 2, 4, and 2 patients in these 3 units. that they are family members who were confirmed. Concerning close contacts, I understand that normally they would be transferred to quarantine centers as soon as possible. In some cases, they might have special reasons to stay at home. For example, there might be certain medical apparatus that make them unsuitable to be sent to quarantine center, and then we will try to make arrangements for them. For example, in some cases, they may be sent to hospital instead of quarantine center. As to manpower deployment, I'm afraid I do not have more details. Yes.
From RTHK, a few questions. First, would you define the situation in Kengchoi in Taiwan as an outbreak now because 6 units have been affected? And secondly, about the arrangement of sending people to the quarantine centers, will the authorities pledge to do it within 1 or 2 days as compared to the recent situation? And thirdly, about the escaped patient, can we know more about his situation before he left the hospital? And what's the risk of this patient transmitting the virus in the community if he's running around in different places? And how will the hospitals prevent such situations from happening again? Thank you.
I would not consider the situation in Kengchoi as an outbreak, but there are indeed more than 6 units affected. Because the units are not, we cannot find any obvious pattern of clustering, either horizontal or vertical. So if the residents got infected from the building, it may be due to some environmental encounters or environmental contamination. So we cannot establish obvious link among the cases yet. I understand our relevant colleagues, they would try to send all those close contacts to the quarantine center within 1 or 2 days, except for some special cases which may be due to medical related or some special diet or some special arrangement with their pets. So sometimes these factors may delay a few people being quarantined.
For the QEH escaped patients, we understand that the patient is all along stable and conscious and didn't report any symptoms. And before his escape, he didn't have any abnormal behavior. And we only understand that he went out of his own isolation room and then ran out of the isolation ward. So we appeal to the confirmed patients to cooperate with our healthcare staff to receive appropriate care in the hospital and to minimize the risk of transmitting the infection to the public.
Yes. I'm from TVB. I'd like to follow up on the QE patient, whether the QE has any contact with the medical nurses and medical staff or cooperation with them. Have you received any information on this patient? Were the doctors and nurses busy doing other things and therefore they were not able to monitor this patient? And how are you going to review the situation in QE? Concerning the QE patient, his situation had always been stable. He was conscious, and he did not display any symptoms relating to COVID-19. And his clinical report, he had some viral load, and therefore he was required to be in isolation ward. During his stay in the isolation ward, from time to time, he had to be persuaded by our medical staff to carry out certain medical and monitoring procedures. On that day, he was staying in an isolation ward. The room and the ward itself, there were 2 automatically closed doors. And from time to time, we will also monitor the patient's condition. And we also have a surveillance system with no recording function to keep watch on the patient's condition. We understand that previously this patient had been uncooperative, and he finally cooperated with us after some persuasion from our staff. We have cooperated with the police in the investigation, and we'll call on all those patients in the isolation wards to be cooperative with our medical staff and not to leave the isolation ward without leave.
I'm from Mingpao. Dr. Yu, for this QEH case, what is the CD value for the patient, and how infectious is the patient? Now, you say he's been uncooperative. Does it mean that he did try to leave the room before, or what do you mean by him not being cooperative? And then, say there are some high-risk patients, maybe you have to consider how to step up security at the hospital, right? So apart from nurses and staff in the ward, would you consider deploying more security guards to isolation wards to keep watch? Now, for King Choi Court, Dr. Chuang, you say the units, the number is the same, so how many floors are they apart? And then next to King Choi Court, there's Feng Hua Estate, which has relatively a large number of cases. So is there an outbreak too, or is it actually the same household? And then in Feng Yik house, Kwan Yik building, in 2 weeks there have been 7 cases, as some reporters have mentioned. So is that an outbreak too? For Henry G. Leung Community Center, you couldn't find a patient before. Have you found the patient now? And then in the past periods, we have we've been hearing about cases that's a delay of sending quarantine people to the quarantine center, but then in one day you're able to clear the backlog. So what happened? Is it because many departments have provided assistance? That's why you're able to do it now. You could handle 480 persons for the transportation to quarantine center now. So are you confident that you'll be able to send all close contacts to quarantine center within a day from now on? Now, for the QE patient, the CT load is 20-something. It's not high or low. Now, in some regular examinations or monitoring, there was a need to persuade him repeatedly before he would cooperate. And the day before he left, he did try to leave the ward, but then our staff advised him and persuaded him to go back to his ward. And then also our staff would do risk assessments from time to time, and we'll make related arrangements. Now, for this patient, their assessment was there's no need to, restrain the patient in any way. But if it's a high-risk case, then suitable arrangement will be put in place. Say, in special cases, arrangements may be made, but it will depend on the individual cases. For King Choi Court, the unit was the same number. The 2 units are 8 floors apart. For Kwan Yik, I mentioned it is one of the buildings for which we will distribute specimen bottles. So it's Block D, Phase 2 of Kwan Yik. There are 8 cases now in 3 units. And in 1 unit, there are 6 family members infected. In the other 2 units, there's 1 person each. For Feng Hua Estate, some cases are in Sao Feng House, some are in Hiu Feng House, so they are in different blocks, and they are all family clusters. So the details, yesterday there is a special operation involving different departments, and then we were able to send 480 close contacts to the quarantine centers. Now, usually we would be sending 200 or 300 people a day to quarantine centers. I'm from Oriental Daily. For King Choi Court, the 6 units, on which floors are they? And then you mentioned 2 vertical units. Would you ask experts to go and inspect those units? And how many specimens have you tested so far? And how many preliminary positive cases are there? That's my second question. And for the QE case, the day before the patient fled the hospital, he did try to leave his ward. How come the risk assessment for the patient remained the same? How come you did not upgrade the risk level so you would monitor him more closely so that now he had a chance to walk away? For the Henry G. Leung case, no, we haven't been able to locate the patient. For King Choi Court, for the 6 units, 2 are facing the same direction. And there are many similar cases in other buildings, where there are 2 units, with the same orientation, maybe out of 3 units, 2 face the same direction, the other one doesn't. So it's hard to say whether there's a link. But if we see more such cases, then we'll see whether we should ask experts to go and check things out. But for now, there's need to do testing first. Hopefully then we'll be able to identify all the cases. Today, there are some 70-plus preliminary positive cases. For the QE patient, he tried to leave the ward on his own the day before. That's why our colleagues were alerted, and then so they stepped up monitoring. But then perhaps he moved too quickly, and then staff were busy with something else. But as soon as they spotted him leaving, they tried to pursue after him, but they failed to catch him. First question. Your organization, please. Hong Kong 01. The first question is for the moderator. Yesterday, a colleague used the term Wuhan pneumonia. Now, we've had over 300 such press conference briefings so far. People have been using the term Wuhan pneumonia. How come yesterday, all of a sudden, you made this reminder? Since when has it become a concern, and what is the concern? Second question is for the QE patient. Which patient was he in? Was there a particular room, or what number to identify the particular room? And after the patients left, what means have you resorted to try to find him? And another confirmed case, have you found him? And then about for Shek Ming House, there's a case linked to the dance club cluster. What about the other cases? Can they be traced? And then for Sky Park and the Shek Ming House, what is the, where are the patients found? Now for the QE case, I don't have the detailed information here. For the Yau Ma Tei case, that is where there's just a sample. Yes, we're not able to locate the person yet. The other 5 places you mentioned, King Choi Court, I've already mentioned that. Fuyan House, 3 units of different orientation and floors and blocks even. For Shek Ming House, Shek Ming Estate, there's different blocks and different orientation. Ping Shing House, similarly, different orientation, different blocks or different floors. Sky Park in Mongkok, there are 2 units on the same floor. So altogether, there are 3 units in Sky Park. Over there, please. I'm from Now TV. Kwai Sing, the second test. Have you identified any preliminary positive cases for the specimens tested? And then many district councillors have mentioned that the communication with the Center for Health Protection has not been easy. So would you be stepping up communication with district councillors because then that will better serve the local residents? And a question for HA. Now, if a patient could walk away so easily, does it mean there is a security loophole somewhere? Why do you have to wait till if there are other cases before you consider whether to step up security?
For Kuaishing West, we did not see any cases from the second round, or perhaps because some of the residents are still undergoing tests. As for liaison with the local district councillors, and we have contacts with the district officers. Concerning security, I think you should pay attention to the fact that wards are there to treat patients. Normally, we will not have security guards stationed at the entrance of each ward. Most of our patients are very cooperative because they are sick and they want to be treated in the hospitals. And as I said, we'll do some risk assessments where necessary. We will arrange or make suitable arrangements in line with the patient's situation. For example, for high-risk cases, we may have to make special arrangements. For example, a security guard at the entrance of that ward. But normally speaking, we will not deploy a security guard in front of each ward. Yes, last question. Sorry, I'm from the Stand News. Just now, the press officer asked us not to use the word Wuhan virus. Does it mean that if we continue to use this term, we're going to be banned from entering this venue? Could the press officer answer this question? And yesterday, you also mentioned that there's a task force, and within 3 days, 480 people have been sent to the quarantine center. You said that this is a special exercise. Does it mean that there is a serious shortage of staff? And if so, what some special arrangements can be put in place? Or would you arrange for those who are living alone or those who are chronically ill so that they can be delivered to the quarantine center first? And yesterday, Dr. Chuang, you also mentioned that you arrange for officers to answer questions. And today we do not see such officers, officials. Is it because you are not able to do so? And does it mean that we'll only have to wait for the press releases from the CHP before we can get information? And now that you are able to send 480 people to quarantine centers, does it mean that the 62-year-old female patient who died while waiting for quarantine is a medical error? And are you going to apologize for that? Concerning detailed arrangements, there are other colleagues who carry out coordination with other departments. I do not have such details, and therefore I cannot elaborate on this. Would you arrange for the relevant official who are responsible for quarantine? Because there are so many cases and there are a lot of close contacts as well. This is not something I can decide. Well, I would like to remind you that the WHO has already named the present virus COVID-19. And I have already answered some questions in relation to, the ISD has already answered questions in relation to the press queries yesterday. But are you saying that we cannot say the words Wuhan virus? What is the consequence if we continue to use it? You mentioned that there's some sort of stigma. Could you explain to us what sort of stigma are you talking about?